So, Patrick, as we get this thing kicked off today, I know that a lot of people do anticipate coming to the live training workshop, and it really is the quickest way to get this thing going.
Yeah, but people are always asking, how in the world are you going to train me, in all the aspects of medical billing and coding and, all the things that they kind of know about or think they do in 5 days, and I tell them, look, my wife and I started this business back in the late 80s on our own. We didn't have any guidance, no training, no manuals, no support system, no licensee support website. I mean, we were just on our own, basically. And so it took us a while to get going, but, it can be done. It's just that why reinvent the wheel? You cannot put together what we've put together, our complete turnkey package for $27,000 on your own, folks. I can guarantee you'll spend that on just legal costs, getting all your forms designed, all your marketing material, and of course you wouldn't have some of the tools that we've developed we spent $100,000 to develop.
Yeah, and I tell you, we've got this up here now talking about RCM training, and folks, what that stands for is revenue cycle management. So we've got to the left-hand side, Patrick, that it's this is no longer your mom and pop like you and Linda were, mom and pop medical billing world, because at the end of this particular training, we actually certify everyone as a certified medical revenue manager.
Yeah, so the revenue cycle inside of a doctor's office, they all use that term, and so we use that, of course, here on our marketing flyer. The revenue cycle is everything that has to do with getting the money in for a doctor, and boy, they are struggling right now, especially, Eric, is just, with all the new regulations and electronic medical records and the ICD codes changing recently, all of that has just bogged down and burned out a lot of doctors. So they're really struggling to stay in private practice, and that's why we're here, because we can come to the rescue and actually be the one that solves those problems for the doctor.
Yeah, you bet. And folks, and that's why we say it's more than just medical billing, because medical billing is part of the revenue cycle management. It's just an arm of it. And so, Patrick, I know many people have seen advertisements on the internet to say, hey, come learn to be trained to be a medical biller. But that's not what we're doing. We're teaching somebody how to have a revenue cycle management business. You want to kind of talk the difference between the business side of medical revenue management versus just a medical biller?
Well, like you said, Eric, there's a lot of stuff out there on the internet, courses and, books that you can buy on how to, start your own medical billing company. But that's not what we do, folks. This is different. If you want to go learn that kind of thing, yes, you can find stuff on the internet, or maybe at your local, junior college, how to be a medical biller, and maybe some things about coding even. But that's if you want to get a job. We don't want you to have a job. We want you to have your own business. And there's a whole big difference in that, because you can make a whole lot more money than you can, working for somebody else. But that's the difference. It's a complete system, like a franchise, except we have some real advantages, over the franchises.
Yeah, and again, I'm going to remind everybody that's attending today, over in the question box area, if you have any questions, if you have a question about medical billing versus revenue cycle management, now is the time to kind of talk about that. And Patrick, as we know that at the beginning of the week, everybody is a little bit concerned about how to actually process medical claims, and so we actually start day one with getting them right involved with the iClaim medical billing platform.
Yeah, we bring in laptops, and they're sitting there when you arrive, because by the end of the first day, you are using our system live. It's cloud-based, and so we're connecting all those laptops in the room through the internet connection that we have there at the hotel, and you're using our system live. Now, they're not real claims, of course. You're not going to be sending those to anywhere, but we actually take you through the exact process that you'll be using. And Eric, it's amazing. People that we'll have them do 3 or 4 claims, and all of a sudden they're just kind of bored. They go, well, is this all there is to it? Because it really is not, brain surgery.
Right. Yeah, it's not brain surgery at all. I mean, I love that we oftentimes we kind of use that that terminology. But folks, you know what? I know we don't have any really any polls going on right now, Patrick, but I'm sure you kind of took a poll at the beginning of training this week, and did you discover how many people have actually had a medical billing background?
One, that's all. Yeah, we had one dentist, a lady who wanted to get out of dentistry, and well, she's still practicing, but she also wanted to start a business that she can retire on and have residual income, which she doesn't have, right? Unless she's in somebody's mouth, there's no income. So for her, this is a eye opener. I just talked to her at the break just a few minutes ago. Her name's Kathy, and she just said, Patrick, this is way better than I thought it was going to be. We get that all the time, though.
Yeah, you bet. We certainly do. Shirley's asking the question, do you help us get doctors? And Shirley, I didn't want you to think that we forgot about that question, but we're going to get to a big section of our webinar here in just a minute, talking about us, how we help you do that. But before we answer that question, Shirley, let's kind of get through some of this first part of the stuff, and then we'll get to that here just shortly. But again, folks, you're going to get this iClaim training, and a lot of people think, Patrick, right off the bat that you know, we're going to sell them a piece of software. We're going to sell them some like a medical billing software, but ours is more than just medical billing. It's what's called a practice management system. You want to kind of go into a little bit of that, about, you know, it's everybody's using it, the biller, the doctor, the front office staff.
Sure. Well, because it's cloud-based, and let me kind of explain that, folks. That means nowadays, if you have an internet connection on your computer, any computer, it doesn't matter, Mac, IBM, it doesn't matter, even on your iPad or on your phone, you can actually access our system, because if you have an internet connection, you simply go to the website that we give you, a special link, you log in with your credentials that we give you, and boom, you're using our system live across the internet from anywhere in the world. Eric, we had a couple that actually traveled in an RV, and they had a satellite on top of it, and they actually ran their medical company inside that RV as they were traveling all over America. Yeah, and we've had people go on vacations to Hawaii, and for a month they're sitting there on the beach. As long as you're near a hotel or somebody that has an internet connection, which is just about everywhere nowadays, you can actually run this business. Yeah.
So folks, again, your training today, just think of this as your introduction,
right.
Your own training here that you're going to be receiving from us, and so understand that the iClaim platform is, again, a practice management system. The doctor's using it. Like I said, the front office is using it. The billing, you as the billing company are using it. So we would love to be able to show that to you, and we can do that for you in a live go-to meeting if you'd like to. But here it is, Patrick. Here's one of the training classes, and this is up at the front is Cynthia and our director of operations, Jordan Ransom, up there, and she's actually kind of going through a demonstration. And then, folks, I don't know if you can see that, but over to the left, you can see those laptops that Patrick was talking about, and she's actually kind of guiding people through it right now.
Yeah, all the tables have the laptop on there. We usually put two people to a table so they can be partners and share in the experience of learning the system. One person will put in a claim, then when they're through, the other person puts in a claim, and they're back and forth until we really feel good that everybody has got the basics down. Now, folks, that doesn't mean there's nothing else to learn about the system, of course, but the basics are so simple once you see it done, it's just amazing.
Yes. And so again, what we're going to do now is over the next 2 to 3 minutes, we're just going to kind of show you an example of this hands-on training that you're going to get. Now, you see to the left, folks, this is a insurance claim form. It's been known as called HIPAA. It's been called a CMS 1500 form. And so remember that as we go through the presentation, because it's going to kind of go along with Shirley's question of how do we have to get doctors, because I'm going to give you a little secret. Any doctor that files that form to the left, that red form called a CMS 1500 form, you will be able to do billing form for them. And we're going to show you real quickly how that's done here through our iClaim training. We're going to have, like I said, you see the laptops out there. You're going to get patient intake forms and super bills and learn how to do all that. And again, Patrick, this is a few more shots of people literally going through this part of the training and inputting that information right directly into the iClaim platform.
Yeah, and Cynthia is so good at this. Our instructor, folks, in this picture here is a lady who actually started her own business with our training 10 years ago. That was 2008, Eric, that she came through training. And for the last 4 years, she's been actually training, doing these classes for us because, as you'll find out from her story, she has a large business now, has opened up an office, of course, has staff members there, I think about 10 people that are actually working for her. So she can leave town, come down here for a week and teach this. And the great thing about that, Eric, is you're learning from somebody who's actually doing it. That's
Right.
much better than just hearing from somebody like myself, even though my wife and I did do it back in the 80s and 90s. You know, we're not in that business now. We don't compete with our licensees. We are not in medical billing. Now, let me tell you why that's important. There are companies, and some of them have gone out of business, but I'm just saying that we've had competitors in the past, Eric, that's what they do. They are a medical billing company, and they sell their software directly to the doctors.
Right.
And that's just not what we do. We just don't do that. Ours is private labeled. It's only for people who graduate from our training.
You bet. Trinicia, you asked an incredible, great question. And Patrick, I'm going to ask the question, I'm going to answer it, and then I'll let you comment on it. But you asked, what if the doctor doesn't want to switch systems? This is so key because the way in which we have a difference in the market is because of our software. So I'm going to answer your question with a yes. The doctor will have to switch systems, but it's because you have discovered of how much money that they've actually lost. And the reason that it's so important for the doctor to switch from whatever billing system that they're currently using to ours is because ours is the only billing platform that has its own clearinghouse. Now, just again, a little bit of information of that. Just imagine that in our system, and our system being the only system that can actually deliver a claim directly to each of the insurance companies without having to go through some third-party vendor out there in the market called a medical billing clearinghouse. Ours is just internal, so it makes the difference out there. And this is what we do to help you get that doctor quicker. Patrick, you want to make any other comments on that?
Yeah, I don't know if we've mentioned it in this webinar. Of course, we have in previous ones. But, folks, the rejection rate on claims that are submitted through most software is up around 30%, meaning the doctors are only getting 70% of the money that they could be getting. Now, we can't collect 100%. There's nobody out there that can do that because there's human errors and some people are not qualified for their insurance and so forth. But we have a nationwide rejection rate of less than 2%. Now, let that sink in, folks. 30% is what most doctors are seeing. Ours is less than 2%. That is additional cash in the bank every month, and we're doing all the work for them.
Yes. Yeah, you bet. So what we're going to do for everybody, kind of just sit back and watch what we're going to show you, because this is what you're going to do in that live training workshop. You'll be able to pull the iClaim platform like you're seeing right now. We're going to come down here where it says billing, and we're going to come right over here where it says professional claim charges. Now, this is important, Patrick, because a lot of people want to start asking, well, can I do dental billing? Can I do hospital billing? Folks, what I've already said is that this system does the billing for what's called CMS 1500 forms, which is what's known as professional claim charges. And those are all of your doctors, nurse practitioners, chiropractors, all your surgeons, because dental billing and hospital billing are actually done on a different platform than this. So we're talking about what's called professional charges. And this is Patrick, this is what we would say, this is our wheelhouse. This is what all of our licensees are doing. I don't think any of them have ventured out into dental or hospital billing.
Well, they haven't had to because the market is so huge for the medical billing. Folks, there's over 100 specialties out there. Some of them I can't even barely pronounce. Doctors who do all kinds of specialized medicine, all of those you can bill for. So it's just almost unlimited out there. And having said that, I just heard from this dentist this week, Eric, and she said there's just not anything compared to dental billing. You don't want to get involved in dental billing, she said. I don't want to get involved in it even.
Yeah, good thing to hear that.
Yeah, you
All
have
right,
to attach x-rays, and there's just all kinds of differences there between it. Same way with hospital billing. Folks, if you think hospitals are your market, believe me, they're not. They already have a system they've invested probably millions of dollars into. They probably have a dozen people that are handling the billing, and it's just not a market. Now, having said that, there are some smaller hospital type buildings out there that have doctors who work in the EHRs and things like that, who they are prospects for you as well. And there's people who call on hospitals that are called hospitalists.
Yep.
Hospitalists, and those doctors you can bill for those as well.
You bet. And so again, we're just going to take you on a brief little tour of, again, doing this create claim CMS 1500 form charge entry. Many times you're going to get the information directly from the doctors, especially if they're using our EHR system. That'll automatically come in, just like you can see right down there. I've kind of circled that down there. So whether that's coming in from our EMR system or whether there was a feedback there, sorry, or you're actually manually putting that into our system, this is where what's called the diagnosis code. You can see that R05 turned into a cough. That's what that diagnosis is. And then we're going to come down to a little bit further down into the claim here, and we're going to put in the dates of service here, and we're going to put in some other information here. As you can see that I'm just typing all that in there. So that first number 99213 it's what's called the procedure code, and it's going to deliver what the cost of that fee is, and this 95115 is an injection code. And so these are the codes that, again, folks, are delivered from the doctor to you as the medical biller. And folks, this is really the easeability of what we're showing you right here. And then once you've got that information in there, you're going to click on create claim. And once you click on that create claim, boom, you've actually created a claim. And Patrick, I guess they go, what, an hour and a half, 2 hours of just systematically putting in claim after claim after claim.
That's right. And having mentioned the codes, folks, just remember, we're going to talk about that here a little bit in some of the services that you can offer, but you do not have to know those codes. Those codes are built into this system. All 60,000 of them or 70,000, whatever that is.
You bet. All right, so when you get through that one part of it, we're going to teach you about our EMR system, which is electronic medical records, or sometimes what's known as electronic health records out there. And Patrick, ours is obviously, again, integrated into our system. And kind of going back to Trinicia's question, does the doctor have to switch systems? This is an area that they do not have to change. Now, for the billing and getting the doctor their money, they're going to need to go on iClaim. But if they're already using an EMR system, they can stay with theirs. But obviously, we want to be able to transition those doctors to our EMR system, because EMRX is a cloud-based system, all-in-one certified EHR technology system that is fully, again, integrated with iClaim. So, Patrick, I know that people are trying to think, what does integration mean? I guess we can just basically tell them it's part of the system. It's no third-party EMR systems.
That's right. There are systems out there that have plugged together, I guess is a good way to put it, various systems that are developed by different companies. Folks, this is all developed by the same developers. It's all totally integrated. In fact, we have a patient portal that's integrated into it as well. We have real-time e-prescriptions built into it, lab reports. All of it's completely integrated into our one system. And there's nothing else like it out there. And doctors are wowed by it when they see the demos as well.
Yeah, you bet, folks. And one of the great things about it, I know a lot of doctors are trying to make sure that they chart their visits with their patients easily and try to get the speed in there. And so this gives them a flexibility on the EMR side to touch. There's already built-in notes that they can just go, okay, well, I see this wrong with the throat, or I see this wrong with this particular patient. And they're just tapping that, and it's building the notes for them. They can actually type that in there, or, folks, they can talk right in it. There's a dictation part of our system built right into it. And if they're using an iPad, an Android tablet, or Patrick, even a laptop that has a microphone, they can dictate into it as well.
You know, the doctors love this because they literally go home sometimes and spend hours catching up on the notes for the people that they saw that day. And this is what's incredible about this, Eric, is that we've got doctors who say that they've reduced that down from, say, 20 or 30 minutes per patient sometimes down to like 90 seconds because a lot of it is done in front of the patient. They're using the iPad while the patient's there, and they're simply looking down at it and tapping on the various buttons that build their notes for them automatically. Once you see this done, folks, in a demo, you got to see this demo of this system. Ask the person who sent you the email to this to give you a demo. We'll get online with you one-on-one and simply show you everything and answer all your questions. You will be as blown away as the doctors are.
You bet. Yeah, and it is very, very incredible to be able to see this, and it's all driving to. I love how we talk about this, Patrick. It's improving the performance of that office, all the way from the time that the patient walks in to the time that the doctor is seeing the patient.
Here's what we do, Eric, in a nutshell. We free up the time from the doctor and their staff so they can focus on what they do best, which is seeing patients. Right. We take over the hard part, at least for them it's hard, not for us, and we do that for them at about half of the cost that they would be doing it themselves. Because, Eric, when you figure in the overhead of paying people and their benefits and salaries and so forth, and all of the IT support that's needed to support a system like ours, they pay thousands of dollars a year just to have people keep their system up to date, all the codes up to date and so forth. With us, it's totally transparent. It happens every time they log in.
Yeah, you bet. Absolutely. Now, Patrick, we're going to kind of make a shift here, and we're sort of at the bottom of the hour, and we're going to start talking to you about some of the other services. Now, Patrick, we've talked about these as being ancillary services, but you know, Patrick, some of these are just as important as everything else that we've been doing so far. And again, I know a lot of people here on the call, the webinar today is wondering, okay, well, you know, I'm still a little nervous about all these codes, but we're going to go through a coding and audit training during the workshop.
That's right. And one of these services that you're illustrating right now, Eric, is the Code Write, which is basically we have certified medical coders that you scan in the doctor's charts, just a few of them, so they can take a look and see where the doctor's at and see if he's overcharging, overbilling, which he can get in trouble for and be fined by Medicare, or maybe he's underbilling and he should be billing at a little higher rate. So we can solve that problem. This is one of the leaks, I call them, the little leaks in their cash flow that we can plug up with this service.
Yeah, you bet. And so, folks, again, between this service, which is, again, can be just a regular standalone service, and you may not even end up doing the billing for the doctor. Maybe just this and this audit guard. And Patrick, I mean, I don't think a lot of people understand some of the issues that doctors are facing with many times. I mean, any doctor who's seeing Medicare patients is going to be under the microscope from Medicare, but not just Medicare. They could be under an audit from any of the other insurance companies as well.
That's right. They'll come in unannounced to a doctor's office and say, we're here to do a little quick audit, and everybody panics because they have no idea what they're going to do, but they have the right to come in and look at some of their charts and see exactly where the doctor is. And if they find that the doctor's been overbilling, using the wrong codes, in other words, they can fine that doctor up to $10,000 per infraction.
Right. Yeah, that's.
So this service can protect the doctor from that, because by doing the audit, we provide the doctor a nice report that illustrates very clearly to everybody exactly what he's doing in his office. Yeah, there's an example of it there that Eric's put on the screen. So this is a fantastic service. I've had licensees say that they use this to just walk in and talk to a doctor's office about this. They can, walk in and say, who is your Medicare audit manager here in the office? And they go, what? What do you mean? Because most of them don't have one. But it's a good way to get their attention once you've presented this and have this service in their office, folks, you're in, right? You're
Right.
past the glass. You're past that magical glass out front, and you're inside the office offering this service, and it's a natural for them to then talk to you about, their billing.
You bet. And again, talking about billing, we've talked about iClaim, we've talked about EMR, and again, a lot of these services you're looking at are services that could be overlaid already with doctors' offices. Patrick, it was interesting that not too long ago, I was actually dealing with our personal doctor, and they don't take any insurance right now, but they do have some accounts receivables that they're trying to get taken care of. And I was actually telling them about this and the next service that we have, and they said, well, bring me this stuff. We want to be able to see it. So, managing receivables is, like as we see over here sometimes, can be some of the most difficult and one of the last items on their to-do list.
Right, and some of them have $100,000 plus. I mean, just stuck away that they just haven't had time to try to collect. And folks, you're not going to get on the phone, with Mrs. Jones and say, hey, you owe $20 to the doctor, pay up. This is not a collection service. This is a way automatically, an automated online cloud-based system that does all that for the doctor automatically. And so we've collected for some doctors up to 98% of their money, and they don't collect on average, but about half of that, about a half of all the money that they bill to patients nationwide. We get that up to 98%.
Yes, you bet. Yeah, and then choice pay. I don't know how many people were on our webinar that we did last week, but there was a complete article, brand new article that came out talking about higher deductibles and still people not being able to afford insurance and people having to pay, and a cash payout or self-pay or just the simple patient out of the pocket issues. Choice pay is another thing that can just be overlaid in a doctor's office without them having to switch practice management systems or billing services or anything else like that. These are things that you can start, as you would say, kind of start getting your foot into the door.
Well, and that's a great way to think of all these services. If you think about it, Eric, most people will go in if they've started their own medical billing company. They'll just walk in and say, hey, I do medical billing. Do you need any help? And the answer is no. But with our services, you see, you get your foot in the door with all kinds of different services. We've got 7 different services you can offer. And with one of those, you can get in the door. And once you're in, like I said, you're in. And you become their friend. You become a part of that doctor's office staff.
Patrick Trinisi is asking a question. Will you receive extra income from these services?
Absolutely. Every one of these, you're actually charging setup fees. And we go over this in training in detail. But yes, you'll charge a setup fee. Sometimes you can get $1,000 up front for setting up one of these services. And then there's ongoing revenue for you on each one of them as well. So yes, now the big money, of course, is in doing the billing, because if you're billing a doctor, say $100,000 a month in billing for that doctor, and you're charging 6 or 7%, do the math on that, and that's a big chunk of change every month that you're going to be making from that doctor. These other services, yes, you make money on them, but the real purpose of them is to lock that doctor's office in. Look, once you've got 2 or 3 of these in there and you're doing their billing, there's no other billing company in the world that could ever come along and take it away, because they don't have all these services.
You bet. And then I know one of the ones that you like is this document management training. Yeah, I mean, my goodness, this could be not only used for doctors, but I mean, really for schools or universities, attorneys, private schools.
Anybody, any company or organization has lots of paper that they'd like to have digitized, we can do that for them. You can offer a service that scans in all of their documents and puts it online so that they can access it, again, from any device that has an internet connection. They can see the document, they can change it, they can send it to other people. And here's the thing, Eric, it's all HIPAA compliant.
Yeah.
And that's important with medical records. You don't want people being able to, go in and look at these things and send them to people and so forth if it's not HIPAA compliant.
You bet. Now, I've saved the best for last, because this is going to bridge us from some of these things that we're talking about to Shirley's questions of how do you help us get doctors. And it's this service, and you just mentioned HIPAA issues. You kind of tied into this a while ago. You talk about if you walked into a doctor's office and asked them, who is your compliancy officer in their office, they're gonna the hair on the back of their neck stands up.
Right. And what this does, folks, is make sure that they are complying with all the HIPAA compliant rules that are out there for doctors' offices. You'd be surprised how involved that is. Today, in the class, Eric, I heard Cynthia actually say, which I've heard her say this before, that 70% of all doctors' offices are not HIPAA compliant in one way or another. Yeah.
Wow.
And that can mean huge fines for them as well. So again, this service, which is an online service that keeps them compliant with HIPAA and trains their people as they come in, it keeps them compliant and proves to HIPAA, if they ever do an audit, that these people have done everything they can to maintain that privacy.
You bet. Yeah. And so, folks, this leads us right directly into the biggest part of the training week, and that is getting into the marketing. And Patrick goes up there. He kicks this thing off every Wednesday, and that's why he's up there this week. And this is a picture. Obviously, I couldn't take a picture of him today and put it on our website or the webinar, but this is one from one of the previous webinars that we've done, or the classes we've done here recently.
Yeah, folks, here's why that's important that you know that this is a big part of the training week, because again, we can teach you how to do medical billing in a half a day, at least the basics. We can teach you a lot about our other services and so forth in another day, but we take a day and a half, maybe 2 days, to go into detail about how to get your first client, because you can start any business, and if you don't have clients, you don't really have a business, right? So the most important thing and the scariest thing for most people, to be honest, is how do I get that first client? Yeah. And what if I don't get that first client? Well, we're going to make sure that you do, because we have about a dozen different ways that we cover that's been proven over the past 25 years to actually work.
Yeah, you bet. And again, we're going to start off with talking about what your target market looks like. And again, we're going to go through several different specialties, folks, that actually use that CMS 1500 form. Remember, we showed that to you early on in the webinar, that big red piece of paper there. Any of these doctors that are seeing patients, operating on patients, taking care of patients, everything from a massage therapist to a chiropractor to a cardiologist to podiatry, surgeons, everybody is using a CMS 1500 form. This is your target market.
Right, and there's, of course, all of those are clients, and you don't want to turn any of them down, of course, because you'll make money from any of them. But just like in any other business, some clients will make you more money than others. So we're going to focus on the 15 or 20 of those 100 specialties that are really the people that drag in lots and lots of coins. You can probably think yourself that of an example of like a chiropractor might, be charging $75 for each patient that comes in, and a general surgeon might charge, $10,000 for the surgery. So you still get, 6 or 7% of either one of those. You'd rather get 6% of $10,000 than 75. So there's a good way to think about it. We're gonna get you started on the key specialties that we have found you can make the most money from. And then, of course, if you get referrals to a chiropractor, you probably want to do their billing too. I mean, why not? You want as many clients as you can get.
Yeah, because one of the things that we're going to be talking to you about is how to build power partners. One of the power partners that you may get is a chiropractor, but it could be one of your people that are actually doing work for other doctors in the community. I mean, Patrick, I know that you and I both talk to our bankers, and they're dealing with doctors. The CPAs are dealing with doctors. Just about anybody in the community is dealing with a doctor some way or somehow. And we know the quickest way to any engagement with a potential client of ours is actually going to be through some referrals through Power Partners.
And we show you exactly how to connect with those people in your community, folks. There are dozens and dozens of people that you can connect with that do have connections to doctors. In other words, they may be selling a product or service to the doctors that's completely different from yours, but they have those connections. And so we're going to show you exactly how to do that through some business networking training that we give you. That's one of the things we focused on today. And Eric, that's the favorite way for some of our licensees to go out and get their first client is just doing the networking we teach them to do. And it's a very specific way to do it, though. It's not what you think it is, because marketing to doctors is just different from other types of marketing.
And talking about marketing, and I know that we talk about that once you become a licensee here, you get marketing material, and sometimes we don't spend a lot of time on this because it seems so insignificant to some degree. But Patrick, I mean, this is a key element of looking professional, having right information, and obviously with our licensees, we get to actually put their logo and their contact information directly on these marketing materials.
Yeah, we've spent thousands of dollars having these designed and tested and proven, folks. You should have seen some of the stuff that I developed back in the early days when my wife and I were actually doing the billing for some clients. Back then we barely had computers and printers and so forth, and I actually printed some stuff on dot matrix printers. But that's all we had, back then. And so, folks, you can't look like you are, just creating this stuff on your own. You need some stuff that we've developed that really has the right wording. As you can see, it all looks like it's all coordinated, like you're a franchise. And you're part of the nation's largest network of certified medical revenue managers. And so you can position yourself as a part of our network, and it makes it for much more credibility in the marketplace.
You bet.
Hey, Eric, I've got to run here in about 5 minutes. I just want to let you know.
Great. We're going to get to the end here pretty quickly, but you mentioned that we're going to position them as something, but you're going to be the subject matter expert, because not only are you going to have, like Patrick said, you have ABS behind you, but you've been able to go out there, Patrick, and create partnerships with ABS that are helping our licensees. And one that I know that we've done some webinars on in the past has been with Dr. Vicki Rackner.
Yes, one of the things we've done is partnered with a retired general surgeon, Dr. Vicki Rackner. Now, folks, this lady is well known in the medical community because she at one point was, like I said, in her own private practice. She decided to go out and help doctors to thrive in their practices, and so she now speaks to doctor groups all over the United States, hundreds of doctors. She's got 200 surgeons she's speaking to next week, Eric, and she's written several books, as you see illustrated there on the screen. She has her own Thriving Doctors website where she's helping the doctors. But folks, we've partnered with Dr. Vicki Rackner, and now she is partnering with you as a licensee of ABS. She agreed to have your name on the cover of her book as having written the foreword to it. We've already got it written, but you can write your own if you want to. But the point is, your name is on there along with a doctor. It doesn't get any better credibility-wise than that, Eric.
No, it really doesn't. And when you've got this book, and you're learning how to market educational marketing material, and again, as Patrick just said right there, your name goes right on the front of the book, and here is a sample of that. And even on the inside part of it, it's got the licensee's name as a certified medical revenue manager and their contact in right there in the book itself. I mean, and you are in the process of working with Dr. Vicki Rackner on a new book.
That's right. This one is the 9 ways that physicians let money slip through their fingers. Believe me, this one will be just as interesting to doctors as the new Thriving Medical Practice, because most of them are not thriving. They're very interested in that book. This one, they know that they're letting money slip through, and Dr. Rackner spells out in detail exactly what they need to do to plug those leaks. Well, guess what one of them is, Eric? It's to get their billing outsourced to somebody who knows what they're doing.
You bet. Well, no, I know, Patrick, you have to be going in here in just a couple of minutes, but do you have a projection when you think this book might be out?
Yes, this one definitely will be out sometime next year. No, I'm just kidding. Actually, we've got this one almost ready. A little editing is to be done to it, and then it'll be put out there on Amazon. We actually put it out there to build credibility for you as well. But folks, even though it sells for, I think we priced this at $24.95, doctors pay that for good information like this. you can get your name put on the cover of this book as well, and on the inside, for about $4 a copy. That's our actual printing cost, Eric, for our licensees, and they love it. It's a great giveaway type. Well, I call it a business card. You know, it's a very big business card because it has your contact information right inside of it there.
Yeah, and it's very unique. And Shirley, hopefully that's helped answer your questions about how we can help you get in front of doctors, get doctor clients, and yes, they kind of go through your second question. If a doctor is just starting out, can you set them up as well? And obviously, you can certainly.
Yes,
be able
yes.
to do
We've got licensees who specialize in finding out the doctors that just graduated from medical school in their area. There's ways to locate them and you know, go and approach them and get them set up straight out of medical school. So
Yeah.
it's a great market. Eric, I'm sorry I do have to run for another meeting that's coming up, but thank you for hosting this. Guys, he's going to wrap it up here, some real good information about next week's webinar as well. I'm doing an interview with one of our licensees, Austin Morse, who just went through training recently, and I'll let you ask all the questions you want of somebody who's actually been through the training and graduated and is out there building their business. So hope I see all of you at one of our upcoming trainings.
Very good. Thanks, Patrick, for taking your time. I know that you need to get going there, so thank you so much for taking your time out today.
You bet. Bye for now.
All right. You bet. All right, folks, we're going to kind of keep wrapping this up, but I'm going to talk with you real briefly about the marketing training, because it just doesn't end with marketing with just you. If you'd like, we're going to show you how to build a sales team or a sales rep program, if you'd like. Through this, we're going to teach you how to go out there and find sales reps. We're going to show you how to interview for sales reps, actually how to hire sales reps, train them, pay them. And so you may want to use this in the beginning because you may be working part-time, and you might want someone else to kind of do that heavy lifting right there at the front part of it. But at least it maybe just helps you get a connection. And maybe it may not just be necessarily a sales rep. It certainly might just be a sales rep that could be a power partner with you. And so instead of having to pay them over a long a period of time, you might just pay them a finder's fee or some sort like that. So obviously there's many different ways that we're going to teach you and show you, and then you may want to continue this because you get busy doing the billing and you like having a sales rep out there that's doing some of this work out there for you and prospecting and not necessarily cold calling on doctors. It's just they're using their market already. So this is a great way to really get going and build up your business. Now, as we kind of wrap up this afternoon, obviously, and when we get to the end of training, we're going to talk with you about your support. And going over your support is so important for you, because let me remind everybody that once you've made your investment here with us of the $26,990, you are getting a lifetime of support with us here at ABS. And it's not just you're going to get support because of a website that we have that you get to have 24 hours a day, even though that we have that there. But we're talking about real live support, and support from Chad, who is our director of support here at ABS. And then plus on the background, with all of our technology, we actually have support in that arena too as well. So you've got a full support team, and whether it's the coders that we have or the people that keep up our maintenance on iClaim or whatever it might be, we've got that support mechanism there for you, so that you never feel like you're out there by yourself. So we've built all of this on the background for you, that you have, again, a lifetime of support with us. And one of the things that, one of the things we didn't even really get into too much is the ongoing support of us doing live webinars or demonstrations of our software just for you. Now, I'm going to go out to our licensee support site right out over here, and you'll see that I'm actually here live, and I just need to make sure that I am still logged in. Yep, I'm still logged in here. So if you go over here, like under licensee support site, now this is a site that is secured by a password protected for our licensees only. But once you become a licensee, you're going to actually have the opportunity to peruse this, and you'll see here that we've got articles that we keep up here, the 6 healthcare marketing trends for providers in 2018 that just came out last week. How to take care of all of this, HIPAA compliance tip for small practices. So we're giving you information all the time in our news site here. But once you get started, you're going to want to know how to get ready for a live training workshop and setting up your business operations, setting up your website, because that's one of the things that you do get here. Getting to the services of iClaim and Choice Pay, and going in here, this is where you can learn how to get into and sign up a doctor for looking the overview of all of this information, and then even setting up live demonstrations for your prospects. You get that taken care of right here. Excuse me. So we have everything that you're going to need on this website: marketing tools, warm marketing, business networking, working again with sales reps here, direct contacts and follow-up, and all the tools, your practice analysis, all your service agreements, all your business documents, how to customize your books through here, any other types of resources, how to get in touch with Dr. Vicki Rackner right on here. So folks, you're looking at a live shot right here of our licensee support site. And again, we've built that there on there for you in order for you to have all the support that you're going to actually need to continue to keep supporting you as you keep growing your business. And then finally, at the end of the week, as we've said earlier, at the Friday, on the day of graduation, you're getting certified as a certified medical revenue manager. And this is something that you can put on your business card as a CMRM. And that stands for something. And doctors can go out there and look on the Murmur website and see what that's all about and where the certification comes from. So folks, you're going to have everything that you're going to need as you're going to need to get things going for you to open up your medical billing business opportunity with us here at ABS. So for those that are looking forward to coming to one of our live training workshops, let's talk a little bit about that, because it is held here in Dallas. It's a live training workshop. As you've seen, we've tried to show you as many pictures of that particular room. It's held at a Marriott Suites. It's here in the Dallas-Fort Worth area. It's literally right north of the Dallas-Fort Worth airport. It's at a Spring Hill Suites Marriott. Very nice place. Great facility we use for our training there at the workshop, and it's all right there. So what you're going to need to do is, for those that are flying in, you're going to want to fly into the Dallas-Fort Worth International Airport. Now, you're not going to need a car because the hotel will pick you up. So there's no need of having to rent a vehicle or having to go through all that and then filling up the car and doing all that other stuff. The shuttle picks you up from the airport, from the hotel. The classes run Monday through Thursday, 8 to 5, and usually 8 to 5:30. But it does start off at 8 a.m. on that Monday morning, and we let out early on Friday at 1 p.m. Sorry, for those that are traveling, maybe back to the West Coast, or you're trying to get back to the East Coast at a decent hour. So typically, getting through the Dallas-Fort Worth Airport is fairly easy, and you can possibly book your flight, between 2 and 2:30, and you should be fine in getting through security and get on that plane so you can get home early enough. Every day we provide lunch, and that's even including on that Friday when you leave. We have a boxed lunch for you that you take with you, so that's all provided by ABS. But the licensing fee doesn't include the travel or the hotel. So we feed you. The hotel actually feeds you in the morning with breakfast. Again, we serve lunch every day. The only meal that you have to worry about or be concerned about is that one for the evening. But it doesn't include your travel or hotel, and the reason is because one of the things that we do to help folks understand and want to make sure that this business is right for you, we will actually reimburse your investment of the $26,990. So it goes like this, and it's written in our contract with you, our purchase agreement with you, that at the end of training, if you feel like for any reason this is not the business for you, that's it. It doesn't have to be for any other reason. You don't have to say the magic word or do anything else. You just come to Patrick or me or anybody else that's here with ABS and say, you know what, I think you got a great business here. It just might not be for you. And we will refund 100% of your license fee. Now, folks, this is unheard of in the franchise world, the business opportunity world. And the reason that we do this is because we want you to be satisfied, because if you're satisfied and once you leave training that you have got all the training that you're going to need and you feel comfortable with it, then at that point, then you know that you've made the right decision, and we're going to be here to help you build your business. And again, we do help you build your business and find doctors.